Zoom now announces it to us all. So let's get started. And Elaine, if anyone comes into the waiting room, you can just let them in. I think I know everyone here, but for those of you who don't know me and for the sake of the recording, I am Sally, the General Manager of the Central Wellington Chamber of Commerce. We appreciate you all joining us today on what was a little bit of a rush turnaround after my chat with these guys last week. Joining us today, we have Anna and Danny from WDG Public Health. They are going to give us a vaccination update, talk to us about how the vaccination numbers play into that reopening plan, answer any of your questions on reopening, especially fitting given the announcement over the lunch hour that we are entering step 1 on Friday. And then just sort of speak to how to be champions within the community, and I'm sure some other updates as well that they've worked on. So without much further ado, I am going to unspotlight myself and let these guys take it away. If you have any questions throughout, utilize the chat, and I can always jump in and interrupt these guys, or we'll do a long Q&A at the end. You can either type your question in the chat or indicate that you have a question, and then we'll invite you to unmute yourself and ask the question. Take it away, WDG.
Sure. And just as folks, as you're thinking through your questions, Anna and I have a lot of information here. We'll answer as many questions as we can. If you've got some sort of specific interpretive questions, you know, I run a restaurant and I have some questions about step 2 of the reopening. We're going to capture all of those. We're going to make sure that we work with Sally and with our health protection team, who interprets how bylaw and provincial statute are applied. So if you've got them, definitely ask them, and we'll make sure that through Sally, we flow back to you once we get those specific kind of business to business questions answered, so that we make sure we get those back to you.
Awesome. Thanks, Jenny. So thanks for the introduction, Sally. I'm Anna Vanderland. I'm our acting manager of communications, joined today by Danny Williamson. So like Sally said, we're going to give you a really quick overview of how we're doing locally. Going to answer a couple frequently asked questions when it comes to vaccination. And then I'll hand it over to Danny for how we can encourage folks to get vaccinated and continue on the path towards recovery here. So first off, I just wanted to flip up the roadmap to reopen, which I'm sure many of you have seen by now. It's been out for about 2.5 weeks now, I think. And I really wanted to draw your attention to the row across the top there that speaks to these different stages as it applies to vaccination rates. So this is yet one of another reason why having solid, robust vaccination rates in our community is going to be a really important piece of that reopening. So we see step 1, which Sally mentioned we're going to be going into on the 11th, which is Friday, is at least 60% of adults with 1 dose. Step 2 is a 70-20 split, so 70% of folks having at least 1 dose and 20% being fully vaccinated. So that means having 2 doses in any 2-dose series vaccination. And then that final stage is a 70-80% with dose 1 and 25% for dose 2. So how are we doing locally? We have an update to our dashboard, which I'm not sure folks have seen. It came out last week. You can always get the most up-to-date information by visiting our website /vaccine, and that's going to give you our daily numbers. But we were able to update it to kind of match those benchmarkers that were part of that reopening plan. So you'll see, if we look at our adult population, so that's folks who are 18 and over in Wellington, Dufferin, and Guelph, we are so close to 70%. So as of this morning, we hit 69.7%. And then we have around 6 or 7% of folks who have received both doses. So slowly making our way there. We've seen some tremendous progress over the past several weeks as supply has increased. And then I just wanted to break it down for you in terms of age as well. So as you'll likely remember, as per the provincial framework, we were able to start vaccinations with our older, more vulnerable populations and kind of work our way down. So what we've seen over the last several weeks is these bars in the younger groups really shooting straight up. And that's been really encouraging to see that uptake all the way till 12 and up, really. But I wanted to draw your attention to the 75% gray dotted line that goes across there. Ideally, we'd like all of these green bars to hit that line and really shoot on past it. So that's what we're really aiming for here as a health unit. But why we might need your help here. So the overall goal we have is vaccinating at least 75% of our eligible population. Ideally, we would like that to be higher, but that's kind of our first benchmarker here. And the way I can break that down for you is that means about 202,000 people 12 and over in Wellington, Dufferin, and Guelph. Now, to date, we've either booked or vaccinated at least 199,500. So looking for about 2,500 additional people to sign up for first doses. I did see that there was some good pre-registration movement over the weekend, but we're still not quite at that goal. So we really need everyone's voice lent to this campaign to really try and get folks to get out there and get their first dose. So a little bit about the vaccines that we have available in Canada. There's two main types of technology that we're working with here. We have mRNA vaccines and viral vector vaccines. So in terms of mRNA, you've likely heard of the Pfizer and Moderna vaccines. Right now in Canada, Pfizer is being provided to anyone 12 and up, and Moderna for the most part to anyone 18 and up, although we do expect that they'll bring the age restrictions on Moderna down soon as well. One thing I like to say at this point in the presentation is that Pfizer and Moderna are nearly biologically identical. We have lots of folks coming into our clinic asking for one or the other. And we actually even got a statement from NACI, which is our federal governing body that looks at vaccine recommendations. And they kind of said, you know, these two vaccines can be used even interchangeably. So they're that similar. So if you're having a conversation with folks and they're like, yeah, well, I don't want to go to this public health clinic because it might be Pfizer, it might be Moderna, and I want the other, I think you can definitely reassure folks that those are very, very similar vaccines and have very similar efficacy. And then we get into viral vector vaccines, which of which the only one available in Ontario right now is the AstraZeneca. And I'll talk about that in a little bit more detail in our FAQ section. But there are more on the way as well, so very encouraging. How does one get a vaccine from public health? So the way you can do it is register at our website /register. Right now, appointments for a first dose is being given to anyone 12 and over. So what you do is if you go in there, put in your information, you'll receive a booking code from public health in 5 days or less. And in most cases, it is quite a bit less, but we like to say 5 days, just in case. And you'll be able to log into our system, pick a date and time and place that work for you, and go from there. And this is becoming a hotter and hotter topic as we go, which is great that people are eager to get their second dose. So if you check out our website /appointments, you can find all of the information that you might ever need about second doses. There's been lots of announcements recently about specific populations that are able to get a slightly accelerated second dose. So we have all that information available on our website. But the general rule that we are following right now is public health is contacting folks. If you received your first dose through public health, we will connect with you in advance of your dose interval coming up and book you in for your second dose. So right now we are calling or emailing everyone. And if you got your first shot after March the 9th, just sit tight and we'll be in touch with you soon. And if you got your shot on or before March 9th, or maybe you got your shot outside the province or something like that, and your window is coming up, please give us a call at our number listed right there. And there are other places that you can absolutely get a vaccine as well. The way that vaccines are counted across the province, it's all through the same system. It's called COVAX. So whether you get your vaccine appointment from public health, from a pharmacy, from your local primary care provider, doesn't matter, it all counts towards our goals here. So anywhere that will take you, we highly recommend get the soonest appointment that's available to you. For pharmacies and primary cares, it's best to kind of call and check their availability because it does vary from site to site. what vaccines they have available and what kind of availability they have for bookings. But right now, those primary care providers and pharmacies that are offering vaccination have mRNA vaccines, so either Pfizer or Moderna. So a few FAQs that I just wanted to spin through. We get asked these questions about 1,200 times a day. I'm sure that you might come across them too if you're talking about vaccination with folks, so we just want you to be prepared with some answers. The first one I have was the vaccine development rushed? This is a question we get quite frequently, and what you can know here is that Health Canada only ever approves vaccination under a really specific set of criteria. So the vaccine has to be safe, it must work, must be effective, it must meet our manufacturing standards, which are some of the highest globally, and the benefits must outweigh the risks. So before you can get an approved vaccine in Canada, you need to fulfill all of those things, and it's quite a high bar. And then the second piece of this is how in the world do we get these vaccines so quickly? Because usually it is a multi-year process to get some vaccines approved and actually in arms. So there was a couple of things that kind of came together to make this work out. The first one was some dedicated funding. So basically the entire world was trying to solve this problem. There was money available for it. The second was reducing delays in approval processes. So often there's lots of red tape to cut through when you're doing a vaccine approval process like this. The neat part here is that we were able to kind of just cut back on some of that. The third is the ability to quickly adapt existing research programs. So for me, the first time I heard about mRNA vaccine technology was when Pfizer and Moderna came out. However, this technology has existed for the last decade. We were able to take this really neat piece of technology and adapt it to the current problem we are facing. And lastly, and probably most importantly, we were able to change the design of a lot of our clinical trials, not in any way cut corners or have less data to work with, but usually vaccine trials are incredibly linear. So you have group A, follow them in time, group B, follow, group C, follow. But what we were able to do was actually start groups A, B, and C all at the same time and follow them together. And that really helped to cut down the time that these trials required. The second is, what are the side effects of the vaccine? Lots of folks are nervous about these, and rightly so. You're doing something medical to your body, you should have questions. And here's an answer for this one. So common side effects that you might see that happen, about 1 to 3 days after vaccination and last maybe 1 to 2 days, are the same side effects that we see for just about any vaccine that you might get. So things like pain, like a sore arm, headache, fatigue, muscle joint pain, chills, and a fever. So that's what you might expect. There's also lots of questions about the long-term safety of these vaccines. I wanted to reassure folks on the call that the medical and scientific community is very confident in the long-term safety of these vaccines. There's nothing in the technology, in the clinical experience, or anything else like that that would indicate any risk for a long-term side effect from these vaccines. Next question is, can I just get one dose? We get this one quite a lot, folks who have gone to the effort of getting their first dose and really can't be bothered with the second for lots of different reasons. But what I'll say is that first dose does a really good job in providing effective protection. But that second dose is what's going to help your body extend that protection over a longer period of time. So it is in fact really important to get both doses for a longer period of protection. So we'd highly recommend getting both doses. Can I choose which vaccine I get? So I touched upon this one a little bit earlier in the presentation, but really there is no guarantee you will ever get a choice of a specific brand at your appointment. It's really, public health is provided primarily with the 2 mRNA vaccines of Pfizer and Moderna. And it's what our shipment is that week that we're able to provide to our mass immunization clinics. But like I said, these 2 mRNA vaccines are incredibly similar. So we really wouldn't suggest folks turning away a vaccine at any point when it's offered to them. And then we get into unpacking the AstraZeneca piece. So I'm sure folks have heard lots about AstraZeneca in the media over the last couple of months. For anyone on the call who got AstraZeneca, I'd like to reassure you that you made the right choice. By getting a vaccine, you protected yourself, you protected the family, your family, the people around you. But there has been some recent movement on what it is that you can do if you got your first dose of AstraZeneca. So you might have heard the province has taken a pause on providing any more first doses. And that's really out of an abundance of caution because of some very serious blood clots that have been linked to this vaccine. So what they have done is provided an option. So option one is you can, for your second dose, receive another dose of the AstraZeneca vaccine. Or option two, you could receive a dose of an mRNA vaccine like Pfizer or Moderna. So those are the two things that are available to you. We have lots of good information on our website about this decision. But once you've made the decision, basically you can, if you would like to get a second dose of AstraZeneca, connect in with the pharmacy or primary care where you got your first dose to book your second dose appointment. If instead you wanted to do the mRNA route, you could do the exact same thing, connect with your pharmacy or primary care that you got the first dose from. Those folks at this point likely have an mRNA vaccine, whether it's Pfizer or Moderna, and will be able to help you out. Or you can book your second dose with public health. And we are just about to light up an option that will allow you to kind of register through our system and get booked into one of our mass immunization clinics. So stay tuned to our /appointments page for more information on that if this applies to you. And now I hand it over to Danny to talk about how to be a vaccine champion and help encourage vaccination rates to keep on climbing.
Yeah, thanks so much, Anna. And so I think for the folks on the call here, two reasons why we want to talk about this. One, we talked about the 75% target. 75% is a good number. It gets us well into the place where we need to be to get through the roadmap to reopening, which as part of our local business community, we know it's exceptionally important to you to get back operating something close to normal as quickly as possible. But we also know the more folks we get vaccinated, the more people are protected, right? So when we talk about herd immunity, 75% of folks getting vaccinated is likely not going to get us there. You definitely want to be up into the 80 or 90% number. And then you want to get there to make sure that everyone is protected. And so we really want people to think about how they can be a voice, whether that's with their family, whether that's with their friends, whether that's in their workplace, and really helping people make that decision to get over the line, get that shot, and make sure that they're protected. Anna, next slide, please. So I talk quite a lot about the persuadable middle. So Anna showed you the number of folks who are either registered who have got a shot already, and that is the huge majority of our region. And those eager folks who went out and got the job, got their vaccination, they're waiting on their second dose. Amazing. I'm sure most of the folks on this call are among that group. Thank you so much. We also know that there's a group of people between 6 and 12%, depending on kind of what numbers you're looking at, that either cannot or choose not to get a vaccine and will not choose to or will not be able to. And so what that leaves us is somewhere in the middle, between kind of 19 to 25% in that group of folks who haven't been able to get a shot yet, are having trouble registering, are having sorry about that, folks. And so that group in the middle, the folks who are trying to decide right now whether that's the right time for them to get a shot, we think that there are three basic reasons why they're ultimately going to get a shot. So one, it's going to get increasingly convenient to get a shot. So whether that is more pharmacies, more physicians' office, more supply in the region, it's easier than it's ever been to get a shot in the arm. The second, and we don't really know a lot about this, but we're starting to see more, and we'll see more, I think, in the coming weeks and months, but there's going to be an intersection of policies here. So you've sort of heard that conversation that's been rolling around about vaccine passports. Certainly, it looks like you're going to need some sort of proof of vaccination to travel. Europe has already said that they're going to want proof of vaccination for folks arriving. You're going to see employer-employee relationships, what vaccinated employees, what their requirements are versus unvaccinated employees. And then thirdly, kind of corporate risk management. What is it going to look like to be able to eat in a restaurant or go to the movies? What are those kind of companies going to mandate? And so that intersection of kind of those three layers of policy is really going to mean there is going to be some level of different framework between vaccinated folks and unvaccinated folks. And the third, and the reason we do presentations like the one we're doing today is because someone who they trust talks to them about the vaccine. Research shows that that's a big reason that pushes people over the line to make a choice and get a shot. And the next slide, please. And we talk a lot about, we talk a lot about targets, we talk a lot about percentages, we talk about how many people went through the clinic in a given day, but that's not the point, that's not the end game of all of this. The end game of this is to get back to the things and the people that are important to us, to get our businesses open, to get our public spaces open, to be able to gather together. And all of those reasons are valid, but those are the pieces that push people over the line. I'm sure most of the people on the call are somebody's favorite business in Center Wellington. And so we want for them to be experiencing your business in the way that they were able to before all this happened. And the next slide, please. And so there are a few things you can do if you want to kind of add your voice to this this conversation about getting the shot. Like many of you, public health is on social media. We've got a hashtag out there. We've got these great selfie booths or selfie banners at every clinic. So consider, if you haven't yet got your first dose or you're waiting for your second dose, snapping a shot of yourself, use the hashtag. And then this is really important. Talk about why you're getting the shot. So I often say, we have a little one here at home. We have another little one on the way. So I have a 4-year-old, an unborn, and a pregnant mom in the house. So I am 100% the vector for COVID coming in and out of our house. So I was extremely relieved to get my shot. But also, I really want to go to the movies. Right. And everybody's got a reason. Everybody's got a thing that's important, or people that are important to them that encourage them to get the shot. So something that I always say to people, or that we always say to people, is, can your experiences, whether that's your motivation, whether that's your experience at the clinic, can that help someone get over the line? Next slide, please. Like I said, we're all over social media. You do not have to create this content if you want to be part of the conversation. We're on Facebook, we're on Twitter, we're on Instagram. Say always WDG Public Health. We put out a lot of content. We're answering questions on there. We are sharing logistics information. What are the hours of the call centers? Which clinics are running this weekend? Those kind of pieces. But we're also sharing the most up-to-date information on COVID and on the vaccine. Brand new virus, relatively new vaccine. We're learning stuff every day as we roll this out to the entire global population. So we are trying to put the latest and the greatest out there so people have the right information in front of them to make this decision and to share it with others. Next slide. This is so important. If you're involved in this conversation, if you're talking to coworkers, that friend from high school who posts weird YouTube videos, your mother-in-law, it's so important to get to evidence-based sources. If you have looked at all for any kind of COVID myths or vaccine conspiracies, you have only scratched the surface of a a very strange and very dark rabbit hole online. And some of that can be pretty dangerous, some of that advice. So when you're looking for the information, and we want you to do it, right? You're doing a medical thing to your body. It's important to ask questions. It's important to be informed and do research. We want to make sure it's so vital to get that from a reputable source. And I always say at this point in the presentation, it's not only public health. We have lots. The health promotion folks like Anna will gladly turn on the fire hose, and we have tons of information that we're happy to share. There's a couple of links at the bottom there. We have a vaccine info page. We also have an FAQ page that captures some of those questions that Anna talked about, but lots of other ones. We will gladly share all that information with you, but we're not the only source. Other government websites, research universities, your family physician, a nurse you trust, your pharmacist. There are lots of good places to get information on COVID and on the vaccine, but you really want to make sure it's reputable. It comes from an expert, and it's current. And the next slide, please. And so this is how research says, if you're going to talk about this, if you're going to wade into that discussion with your former high school classmate who shared the 90-minute YouTube video about what the government doesn't want you to know about the COVID vaccine, here's what research says is the way to do that. You start with the fact, you warn about the myth, you explain why it's incorrect, and you end with the fact a couple of times if possible. We're not going to change everybody's mind. There is so much misinformation out there. Folks have really bought into some of that, but this is the way. If you want to be as successful as possible in kind of debunking some of this stuff, this is the way to do it. Next slide, please. And just before we jump into the questions, this is so important. The research has shown that the strongest of endorsement, one of the strongest places where folks turn to get a decision made. I mean, I'm sure as folks operating a business, you understand how powerful word of mouth is. It really does matter. It really is supported by research that the most important conversation somebody has about the vaccine might be with you. And so we encourage people, if you think this is important, if you want to protect people, if you want to get our businesses back open, if you want to get things more back to normal, have the conversation, because public health will keep doing everything we're doing. We're going to keep doing presentations. We're going to stay in the media. We're going to be putting lots of stuff out. But ultimately, the thing that might turn the tide for someone is because they have a conversation with you. So that's the sort of the presentation piece now. Very happy for us to answer any questions you might have.
Thanks, guys. Just gonna throw myself up here. If there are any questions, feel free to put them in the chat, or just indicate in the chat that you have a question, and we will invite you to unmute. I have a few, and I will say my vaccination is booked for tomorrow. As a former farm kid, it's embarrassing to admit I am terrified of needles. So if you want some entertaining coverage, take a look at our social tomorrow, because I'm almost a guaranteed faint. But it is what it is. Danny, one of you, I think it was Danny, talked a little bit about workplace policies. Do we know yet, or is there indications yet of what we can mandate?
Yeah, and so a good way to look at it is to look at other vaccines, right? So, I mean, it's odd to say this because we're in the middle of a gigantic global pandemic that's kind of absorbed the world for the last year and a half. But if you look at other vaccines in terms of, the flu shot, or, Anna and I as employees of public health, we have to have all of our vaccines up to date. So as you look at generally what your vaccine policy is, that's a good framework to start thinking about the discussion. Right. So this is a good conversation to work through your legal counsel, as well as if you have an employee relations committee, or you have a union in your workplace. It's going to be probably a collaborative discussion in terms of what is available under the legal framework, and then what is consistent with people's kind of policy and best practice.
And so then suppose same thing applies to things like in-person events and different pieces, venues or the people planning the events. Is there an indication that we're moving to sort of vaccinated people and non-vaccinated people in those things, or guidelines?
Yeah, and I think if you look, and now really, we've had great success in Canada over the past weeks, and really, it's very likely that this week or next, Canada will pass Israel as kind of the most vaccinated country on the planet in terms of percentage who had at least one dose. But as we were kind of moving up through that stage, you know, it's worth looking at places like the US, like Israel, like the UK, who are a bit further out in front of us in terms of reopening. Now, those are different frameworks, both legally and political, but you can see maybe a bit of a glimpse of the future about what, as we move to reopening, looks like, because it is that sort of mixed framework, right? So you've got some government regulation, you've got some risk management from a corporate level, and then you've got the employee-employer piece. But I think you're going to see from a risk management perspective, I think a number of pieces there. And so I think it's something you'll see starting from the province as we sort of move through the reopening, the roadmap. So we're on track if everything goes well. I think if my math is right, July 2nd for step 2. And so I think between when we open step 1 on Friday and we start to get closer to step 2, you're going to see a lot more of that information come through the province. I think it'll start there. I think you're going to see the sort of the statutes, the provincial legislation start to come together, and then sort of at lower municipality and from a business community, we're going to have to start interpreting those pieces. But certainly, I do think, and this is sort of opinion, folks, so take that for what it's worth. I would think with a healthy grain of salt. But certainly, as you look to some of those other jurisdictions that are ahead of us, there does seem to be a bit of a bifurcation in terms of what vaccinated and unvaccinated folks can do, either in totality or in the same venue. So certainly, you've seen either, especially in the US, I guess, just because they're close, and that's what we've been kind of keeping our eye on, is certainly places where you must be vaccinated to attend. And the last I looked, there was a list of about 100 odd colleges in the US where you have to be vaccinated as a student to come back on campus and live in residence and go to class. And I think now we're up to 3 in Ontario. But I do think you're going to see, not in all cases, but in many cases, sort of different requirements for vaccinated and unvaccinated, and probably first dose and second dose.
Thanks. Any questions? I have Post-its full of them, so I can keep going here. But if anyone else has questions, please feel free to throw them in the chat or unmute yourself, jump in. I'm just going to keep going. My scientist sister will kill me for asking this, but Anna, can you just clarify the difference between the mRNA and the viral vector? Is it just the delivery method of the vaccine?
Yeah, absolutely. I would love to. It is the delivery method. So the way that mRNA vaccine works is it kind of gives your cell like a little message, a little piece of message that translate into the production of a protein. So in no way whatsoever will it interact with your DNA or the nucleus of a cell or anything like that you need to be worried about. For our younger populations, our medical officer of health likes to refer to it as a Snapchat message. But basically what it is, it's a quick message that comes to your cell, and then when it's not needed, it's just gotten rid of afterwards. But basically, the way that both of those two vaccines work is they get your cells to express a little protein that looks in many ways quite similar to the COVID-19 virus that has these little protein spikes outside of it, right? And so then your immune system is able to say, hey, what is this protein? I'm going to make some antibodies that can attach to it, that can recognize it in the future. And then later on in the future, when you might come across COVID-19, your body's primed, it's prepped, it knows what that is and how to respond, so you don't actually develop an infection.
Thank you. I gave Danny a break there, but I think we're coming back to you here. In the roadmap, step 3 is 70 to 80%. that's a 10% difference. Do we anticipate getting a firm number there? What are thoughts?
Well, that's a great question. And let me cast my mind into the thinking of the provincial government, because I'm sure everybody's always comfortable in making that kind of
Sure.
theoretical leap. So I think you're going to see something firmer. I actually think it will have to do, so if you look at the roadmap document, it does say the vaccination rate plus other health indicators. So I actually think the other health indicators will drive that. So if cases are really low, if we've really seen this third wave kind of crash and flame out, and we look like we did maybe more like last summer, then I think they would probably tend towards a bit of the lower end. If we see, obviously this Delta variant is pretty concerning. So if we see that get a bit of a foothold here in the province and cases start to rise again, I think you're going to see towards that higher number. That's a guess. I try, Lord knows, like this last year and a half, I try really hard not to speculate what a provincial decision might look like on any given day. But that's sort of my gut feeling on it.
While you're in the minds of the provincial government, if I could ask.
Don't keep me there very long, please.
Are we anticipating changes to the roadmap in terms of, like, not necessarily the numbers, but like the details of each step?
So we haven't had any indication that it's changing.
Okay.
However, we've had other roadmaps, we've had other frameworks, we've had the vaccination program, and all of those have changed and evolved kind of over their lifespan. So I would be, let's call it, unsurprised if there were some changes to the roadmap. And in all fairness, I think what those changes in, whether it was the previous kind of color-coded framework, whether it's been in the vaccination program, those have been to try and be responsive to kind of conditions on the ground. So I think the hope is that it will be something like that, if not a little better, right? It's possible it could change. We opened 5 days earlier than they thought. So certainly possible if vaccinations go really well over the summer, we could look something a little bit more open. But I think it'll really depend, not unlike my last answer, to how are vaccinations going and what do the cases look like. I think that's going to be, it's really the intersection of those two things that drive how far off we're going to be, I think, from what's on paper right now.
Okay. And then on that note of vaccination, I know previously there's been concerns with supply and different things. Has that sort of evened out? Are you feeling some consistency in your supply, less concerns as maybe in the past?
Yeah, I think when you look at the first week we did vaccinations here in the region, we had 976 doses, I think is the number. And the reason I know it's that number is because we got one tray, and then I think we went maybe 2 weeks before we got any other shipments. So it does fluctuate a little bit, let's say month to month, usually not week to week. And so we know we're expecting a little bit of a dip over the summer, but I think we're much more confident that we're going to be in that, sort of 10 to 12,000 to 15,000 doses in, kind of vacillating in and around there over the summer. So certainly enough to keep the momentum going and make sure we're getting, as many of those first doses as we can gobble up, but also really pushing hard to make sure we get that second dose number up as high as we can. So, I mean, we'd always take more. I'm sure folks have heard, we sort of have the capacity to do quite a bit more than we're doing. And that's just the reality of, we're in a global supply chain for a thing that everybody wants. And so we built a framework that could scale up pretty high. So, we would take it and we would vaccinate people faster. If they said, here's an extra 100,000 doses in July, we would absolutely not say no to that. We would put those in arms as quick as we could. But I think we don't have a worry that that the tap's going to get turned off for August and everybody's going to be left in the lurch. I think we're pretty confident of, that sort of baseline that we've sort of started to come to expect now, kind of being more or less consistent over the summer.
Thank you. I am now at the end of my list of questions. If anyone wants to throw their name in the chat or unmute themselves, I'll maybe switch us all over to gallery view just to see if there's anyone. Other than that, that is, I think we're at the end there, folks. Danny and Anna, that was all you sort of had, unless there's any questions. If you have any very specific questions and you want to hang out for a bit, we will stay in the room for a few minutes here if you just want to ask Danny or Anna a very specific question. If you do have specific business reopening questions, feel free to throw them in the chat or send them as an email, because we will get the public health team to provide answers to that. It's not necessarily Danny and Anna, but they have access to the team who can answer that.
Yeah, you want us to get that answer from our health protection team. You don't want Anna and I answering those questions for you.
That's the phrase I was looking for. Question in the chat. Have you thought of setting up vaccines at patios?
Sure. So great question. I think we've looked at a lot of stuff, and ultimately, so a couple things. Bigger clinics are more efficient, right? So, doing somewhere between 300 and 1,000 or 2,000 doses in a day at a clinic is much more efficient. And also, every time they open a clinic, even though we do lots of vaccinations, there's a lot to learn every time they open one of these clinics. And so I think they would favor, we, public health and the partners would favor kind of keeping on where we're on and expanding things like doctors' offices, pharmacies, because of the setting, right? So especially the Pfizer vaccine, and I know, Sherry, you were being humorous there at the end, but I think there's some complicated stuff in administering some of these vaccines. And so being in sort of a controlled, like medical or medical adjacent kind of a setting is really important to make sure things are stored correctly. The drawing of the vaccines can be very challenging. So you really want to build a setting where all those things are as straightforward and controlled as possible. So yeah, I mean, you'd love to sort of kind of drive around in an ice cream truck and you get an ice cream and a shot as we drive around, but I think the logistics become pretty challenging. Now, if a patio wanted to endorse people getting a vaccine somehow, that's maybe an idea to think about.
I'm thinking more, Danny, more like Grand River Raceway or something, where
Sure.
It's the ones who maybe aren't, because of course I get to talk to the ones who don't want to get the vaccine,
Sure.
right? But if we could kind of set it up in a venue or a place, sort of like what they did at Skyjack. I think the Skyjack setup is pretty fantastic.
Mm-hmm.
But if even at Grand River Raceway, when they start to open up, is you could go see the races, and we have a vaccination clinic,
Mm-hmm.
and maybe they might be a little bit more inclined if it's easier and right there, rather than them having to go through any major
Sure.
issue trying to get into places, right?
And I think what we're doing is our data team is really, over the next couple of weeks, so we're working through the end of all those pre-registrations. And so our data team is kind of crunching those numbers right now to really understand where the gaps are, right? So Anna showed that chart earlier of the age breakdowns. And so if you were to look at that today and you say, what is wrong with young people, right? Now that I'm 40, I'm allowed to say things like, what are wrong with young people? But I think the reality is those folks haven't had access to the vaccine for very long. So really, what we're going to be doing over June is to really start to say, okay, who is actually missing, right? We know we have some work to do with our local Mennonite population, for example. And so our team is working with them to make sure that they have information and access that they need. But that's something that data team will really try and unpack over June, is to say, okay, do we need a clinic at Grand River Raceway? Would doing it there get access to a number of folks who don't have the shot? So it is something we're looking at, and nothing's ever off the table, I suppose, is the right way to kind of express it. But I think they're going to try really hard to be data informed in it and make sure that where we go over July and August kind of matches up with who's kind of missing from that overall basket. Right, because ultimately we want to get as many people as we can during this kind of mass vaccination phase, because once we get through the mass, because I mean, my little ones are not old enough to be sports kids yet, but the municipalities want their hockey rinks back, for example, because people want those for the winter. So it will move into a different phase as we move later through the summer into the fall. So you really want to capture as many of those folks over the summer as you can.
Thanks, Danny. On that patio note, actually, some things we're seeing in the States are those incentives to get vaccinated. Is that a direction we are heading here, can head here?
So I don't think, let me answer it this way. Public health has no problem with it. And typically those endorsements in the States are sort of very corporate driven. I saw Dunkin' Donuts, I think it was, you could get a free donut, or maybe it was Krispy Kreme. I don't know. All I know is I didn't get offered a free donut, and I definitely have my shot. So like, I'm not bitter, but I am. So certainly, like, it's a way for people to kind of support the vaccine effort. I think you'd want them to be kind of smart and safe and practical about it. But I think, yeah, any way we can all kind of move this conversation forward, I think it is good.
Elaine's promised me a popsicle if I don't faint tomorrow, so we can all look forward to that. We had just a note in the chat. Just, of course, the township is continuing to work with public health here to ensure the Sportsplex is open to vaccination clinics through the summer. So thank you, Andy and Neil and Stephen are on the call. Thanks to you guys for supporting those efforts. And there is a question here from Patrick. Why should those getting AstraZeneca #2 not be concerned about being as protected as 2 of the other 2?
Yeah, let me just speak to the clinic thing, and then I'll let Anna answer the question about AZ. One thing folks should know is that whether they live and work in Center Wellington, whether they live in Guelph and work up there, like wherever they are in the region, you should be really proud of the effort that's gone on to make these vaccinations happen from the municipal level, from the private sector, the University of Guelph. It really has been an all hands on deck. And, the municipalities like sort of they'd like their hockey rinks back. What incredible partners, just yank the ice out of those rinks. Stuff was getting set up, overnight. There was, electricity and Wi-Fi going in so that we could do this. Like, folks should be really proud of the effort that went on in the region to make all this stuff happen, because it really was, all the municipalities sort of said, what do you need? Right. And they were touring around to each other's sites to make sure that, as some of the later clinics were opening up, that they had sort of an understanding of what had been done in other spots. But it really was, inspiring is kind of a trite word, but it was inspiring to see how hard everybody worked to make sure this happened. So that we are really lucky that the people who came together to make all this stuff happen.
Yeah, and I can jump in with Patrick's question there. Before I do, Sally, when you let folks know tomorrow that you might be a fainting risk, they will take such good care of you. You will be, just so you know, you're going to have like 400 people watching you. They're going to take such great care of you. I have a friend who's
You'll get a special sticker, Sally.
I have a friend who's a fainter too, and at the Linamar clinic, they actually put her in a leather recliner. So I don't know where you're going or if they have that service available to you, but I promise you'll be really well taken care of.
A concrete floor will do, it's fine.
Patrick, feel free to chime in if I'm not understanding your question entirely, but I think you're asking about AstraZeneca, the efficacy of 2 doses of AstraZeneca versus 2 doses of an mRNA vaccine. I see you're unmuting, so I'll let you jump in.
Correct. Yeah, no,
Okay,
I think where sometimes you hear or you understand, maybe not hear, but you understand different stories is if you got AstraZeneca for your first shot, and then you hear stories about mixing either a Pfizer or Moderna with it for your second shot, given the health issues that have gone on with AstraZeneca, what makes me as an AstraZeneca #1 recipient feel comfortable getting another shot of it as compared to mixing with Pfizer or Moderna?
Okay, perfect. Thank you. So what I can say is that both option 1 or option 2, are very safe, very effective options. What I'll also say about if you're thinking about getting AstraZeneca as a second shot, if you didn't have this very rare side effect happen for the first shot, it's even less likely that it'll happen for the second. They'll still give you all the great literature that you might need to make sure that you're keeping yourself safe and keeping an eye on your own body. But either way, both option, very effective. What I'll also just chime in about kind of all the vaccines, dose 1 versus dose 2, is that we're seeing some, as Danny alluded to, some worrying variants out there, like the Delta variant. And as we get more and more variants globally, they might be variants that are able to evade vaccination. So what we're seeing with that Delta variant and dose 1 is that you really need 2 doses for it to be the most effective as possible, really. So another reason to say either option that you want to go with, Patrick, I think just getting that dose 2 is really important. And I'd be more than happy to flip you some literature that the province has come out with to kind of help folks make that decision. I would also really encourage you to give your family doctor a call and talk it through. You might have your own specific health profile that would make one or the other a better choice for you. But what I can say is that both are going to be highly effective.
Okay. Thank you very much.
Something we're thinking
Great.
about.
Thank you.
Something we're thinking about in terms of this whole AstraZeneca situation is really 2 things. One, the way these decisions are made are always made through an abundance of caution. And the second is we have this incredible luxury to be able to put a pause on AstraZeneca. So the reason why you're not seeing more AstraZeneca first doses is because we have these 2 incredible other vaccines and that are coming into the country at much bigger supply. If Pfizer and Moderna didn't exist, we'd all be lining up to get all the AstraZeneca we could. And because we have this other supply, we were able to go, okay, concerning, very rare, but concerning outcome potentially from AstraZeneca, let's pause. Let's use these other 2 incredible vaccines. And so really what this is it's the surveillance system working as it's supposed to. And then it's this luxury of these 3 great vaccines in volume in the country that gives us the ability to say, we would rather not risk it.
Okay.
Thanks, guys. Any other questions for the WDG team? Feel free to unmute or toss it in the chat. As
you are pondering it, Sally has our contact details. You're more than happy to reach out to us. Our Anna and I call this the traveling road show. I think this is about 30, maybe more presentations we've given like this one. We are very happy to go anywhere and talk to anyone. So you are more than welcome to touch base with us through Sally, and we would be glad to come talk to your group.
That's a great note, actually. You would sort of speak to a business team, like a staff team or anything like that.
Anybody, anywhere. Anybody who wants to help get this vaccine program done and over with and get us back on our patios and into our movie theaters and into a room with our loved ones. We are happy to make sure you have all the information you need to help get that message out.
Amazing. Well, thank you so much for your time today, guys. I will let you all go. I will stop the recording, but I will hang out for a few minutes here. So if you do have reopening questions or questions you'd like to ask us, please don't hesitate.